talk about pregnancy. This year, a lot of women get pregnant, especially this time of pandemic. A lot of couples or married people have time to each other, like having sex or making love. Woman can get pregnant without a sperm of a man. Only man has a sperm. If a man releases sperm into the egg cell of a woman, then the fertilized egg travels down into the uterus where the implantation occurs. That is a successful implementation result of pregnancy. But if a woman don't like to get pregnant, there are also effective forms of birth control. Teenager must know about birth control because the highest rate or the most pregnant women are only a teenager. Now, let we know the signs and symptoms of pregnancy. Signs and symptoms of pregnancy will appear after a week or a month as the hormone level change. First, missed period. Missed period is one of the earliest symptoms of pregnancy and the most the classic one. However, a missed period doesn't necessarily mean you're pregnant, especially if your cycle tends to be irregular. That's happened to me a lot. Second, headache are common in early pregnancy. They're usually caused by altered hormone, especially hormone level and increased blood volume. If your headache don't go away or are especially painful, you need to contact your doctor. Third, spotting. Some women may experience slight bleeding and spotting in early pregnancy. This bleeding is most often as the result of implementation. Implementation usually occurs 1 to 2 weeks after fertilization. Early pregnancy bleeding can also result from relative minor conditions such as infection or irritation. The latter often affects the surface of the cervix, which is very sensitive during pregnancy. Bleeding can also sometimes signal a serious pregnancy complication, such as miscarriage, ectopic pregnancy, or placenta previa. Fourth, weight gain. Well, you can expect to gain between 1 and 4 pounds in your first few months of pregnancy. Weight gain more noticeable toward the beginning of your second trimester. Fifth, high blood pressure or hypertension. Sometimes develop during pregnancy. A number of factors can increase your risk, including being overweight or obese, smoking, and having a prior history or a family history of pregnancy-induced hypertension. 6. Heartburn. Hormones released during pregnancy can sometimes relax the value between your stomach and esophagus. When stomach acid leaks out, this can result in heartburn. 7. Constipation. Hormone changes during pregnancy can slow down your digestive system. As a result, you may become constipated. 8. Cramps. As the muscle in your uterus begin to stretch and expand, you may feel a pulling sensation that resembles menstrual cramps. If spotting or bleeding occurs alongside your cramps, it could signal a miscarriage or an ectopic pregnancy. 9. Back pain. Hormones and stress on the muscles are the biggest causes of back pain in early pregnancy. Later on, your increased weight and shifted center of gravity may add to your back pain. Around half of all pregnant women report back pain during their pregnancy. 10. Anemia. Pregnant women have an increased risk of anemia, which causes symptoms such as lightheadedness and dizziness. The conditions can lead to premature birth and low birth of weight. Prenatal care usually involves screening for anemia. 11. Depression. Between 14 and 23% of all pregnant women develop depression during their pregnancy. The many biological and emotional changes you experience can be contributing causes. If you don't feel like your usual self, you need to contact your doctor. 12. Breast changes are one of the first noticeable signs of pregnancy. Even before you're far enough along for a positive test, your breast may begin to feel tender, swollen, and generally heavy and full. Your nipples may also become larger and more sensitive, and the areolae may darken. 13. Acne because of increased androgen hormones. Many women experience acne in early pregnancy. These hormones can make your skin oilier, which can clog pores. Pregnancy acne is usually temporary and clears up after the baby is born. 14. Vomiting is a component of morning sickness, a common symptom that usually appears within the first 4 months. 15. Hip pain. Hip pain is common during pregnancy and tends to increase in late pregnancy. It can have a variety of causes, including pressure on your ligaments, sciatica, changes in your posture, and a heavier uterus. 16. Diarrhea and other digestive difficulties occurs frequently during pregnancy. Hormone changes, a different diet, and added stress are all possible explanations. If diarrhea lasts more than a few days, contact your doctor to make sure you don't become dehydrated. If it is happen, it will affect the baby. 17. Or maybe the last. Stress and pregnancy. While pregnancy is usually a happy time, it can also be a source of stress. A new baby means big changes to your body, your personal relationships, and even your finances. If you think you may be pregnant, you shouldn't rely solely on these signs and symptoms for confirmation. Taking a home pregnancy test or seeing your doctor for lab testing can confirm a possible pregnancy. Thank you.